one of three conditions. They need to have blood stasis, which means then that blood flow is sort of slowed down or is pooling in some way that's allowing a blood clot to form. Because in the end, they have a blood clot that's forming either, whether they've been on bed rest for a long time, or they're just bed bound. Blood clot is able to form, and then it travels up into the pulmonary artery that's then actually blocking the flow that's going down into the lungs. They can have some sort of history, especially if they've got a history of cancer, something that's causing inflammation that causes blood to form a lot of clots. Sometimes patients have a history of clotting disorders, and they'll tell you or atrial fibrillation, AFib. We hear about that a lot. So what happens with atrial fibrillation is that blood is able to kind of hang out in the heart for long enough that's able to form clots, and then those clots migrate into the pulmonary artery that blocks the blood flow down into the lungs, and so it's not able to pick up oxygen.
Would that have anything to do with like excess vitamin K? You know what I mean? Like how it affects clotting and all that?
So yeah, so you bring up vitamin K, which is used in like clotting cascade.
That's I don't know anything. I'm just throwing that out there. Just wondering, curious.
I don't think that. I'm not sure about vitamin K specifically. I'm sure that. So vitamin K.
Probably in some kind of scenario where somebody took rat poisoning or something.
Yeah, that's what I was thinking. Yeah, like
Where they were given too much vitamin K.
But no, because vitamin K.
That's the opposite. I was
Yeah.
thinking like.
Yeah, vitamin K
Yeah.
agonist like warfarin is it's blocking vitamin K absorption. I've never really heard of somebody getting too much vitamin K. Vitamin K is used
Or maybe a problem with the body processing vitamin K that would make it clot up
Probably, yeah.
excessively. I don't know.
I've never. There are like
Okay, vitamin K? It doesn't have to involve vitamin K. What causes the blood to clot excessively like that, and in the heart, and move to the OLM?
oh yeah, so clotting disorders. There's a million.
Oh, okay. All different causes and.
Yeah, but generally, it's a what's the right term for it? They're just gonna say, I've got a clotting disorder, clotting disease, clotting disorder. It's hematologic disorder. I can't think of any offhand.
Hematologic.
It's just a blood disorder.
Okay.
Several factors increase the risk, including immobility. Patients that are on birth control are at higher risk for blood clots. Patients, like we said, recent surgery, any recent trauma, inflammation, anything like that can increase what we call the clotting cascade. It's increased risk for blood clots, and these blood clots can end up being, if a patient recently had a DVT, a deep thrombus, deep venous thrombus embolism in the leg, then we worry about those migrating up into the lungs. If a patient is ever on any kind of blood thinner, they need to figure out why they're on the blood thinner, because they're probably a lot of times those are not always completely effective. So those patients are at incredibly high risk for developing PEs, cancer patients, and also some cancer drugs cause PEs. Blood clot, air bubble, fat particle, foreign body, or amniotic fluid can cause an embolism, blocking blood flow through a pulmonary artery. So yes, blood clots are the major cause of PEs, but it can be something else. It can really be anything that's really blocking the flow. It just generally tends to be a blood clot. We worry about if a patient breaks breaks, you know, certain long bones, then like inside the bones, there's actually like fatty tissue that can get sucked up into the vasculature and can go up into the pulmonary artery. So at some point you're probably going to have a test question where you have a patient who had a femur fracture, and then 12 hours later they suddenly complain of shortness of breath, and they have, you know, I think it's like, we call it like a scattered petechiae. That's, we call it a fat embolism. Also, you know, air bubbles. So if you